role is kind of the leading of the non-health response to this COVID-19. We work very closely with the Director of Health and the Chief Pandemic Doctor. So the three of us kind of makes the team that's in charge of all the response in Iceland. It's easy for us to implement solutions to use for contact tracing and other means about having kind of the overview the whole time about the situation and how it was developing from day to day. So we use technology a lot in those matters. We used mobile apps for people giving of information on how they were feeling, and we were also using the same app for communication from the doctors to the people that was in isolation. Early in March, we had a database linked to the police and ambulance system, so there was a warning going to the responders if there was some kind of a connection with COVID at that address that we're going. What measures was taking to try to have the impact on the economy as mild as possible. But of course, for Iceland, which is a country with so many tourists, and the tourism plays such a big role. Situation in some locations that was more difficult than others, then we send out information to the people there, encouraging them to show up for testing. And also what we did is that we used it at our airports and harbors when we are getting tourists or travelers into the country. But as soon as they turned the phone on, they got a message about what to do. So we used the public warning system a lot in that. So they got information, a short text message about the situation, what to expect, and also then a link to our website about the information where we had the information in 8 different languages. So also we used the system for targeting groups. We used the system for example, for the cabinet office and all the staff at the ministry, the key staff, that we use the same system to get messages to their mobile phones every day with the situation and kind of overview what was going on in countries. We're in now the second wave, and we're seeing increase in numbers of infected, and we see increased numbers of people being quarantined because of our contact tracing also. So we are using similar methods that we did in March, but of course what we can do now, having learned from the experience, that we can have it more targeted response now is kind of more focused and more targeted public to be very careful, and but still we have all the schools open and everything is kind of running normal in many of those businesses, and also we have all the kind of important business open, and so life is a bit normal.